This is Hello Healthy, a Dignity Health podcast. Here's Bill Klaproth.
Bakersfield Memorial Hospital was named by the California Health and Human Services Agency in partnership with California Hospital Compare as meeting the 23.9% statewide target rate for reducing low-risk first birth cesarean deliveries. So why is having low C-section rates so important? Well, let's find out and learn more about how Memorial Hospital reduces C-section rates with Brenda McMurtry, a registered nurse and director of maternal child and women's services at Dignity Health Memorial Hospital. Brenda, thanks so much for your time. So first off, what is a C-section?
A C-section or cesarean birth is a surgical procedure that's used to deliver babies through an incision in the abdomen and the uterus. They may be planned at times or unplanned, and it's just another way to deliver your baby.
So then why is having low C-section rates so important?
Lowering C-section rates decreases issues with surgical procedures. When they have a C-section, they have a higher risk of infection, higher risk of bleeding, more scarring, and a longer time period for them to heal, and then it creates a higher risk for future birth.
So those are really important factors to consider when it comes to a C-section. And I know this is really easy for me to say, I'm a guy, but I've been around women my whole life. I have 3 sisters and my wife and friends' wives, and sometimes the thought is, I want a C-section. Get this kid out of me. I'm done. I want to have this kid. But think about the risk factors. You risk infection, you risk more bleeding, you have more scarring, longer healing time, and then higher risk of C-section for a future birth. So those are really important risk factors to consider. So then on the flip side, what is the benefit of low C-section rates for both mom and baby?
The benefit would be getting the baby out in a timely manner for emergencies. If the baby is breech, it is actually safer to deliver the baby C-section than delivering it vaginally, depending on the situation. Or there is a medical emergency for the mother that we need to get the baby out so that we can treat her.
So sometimes the C-section is necessary. When do you make that call? What are the reasons a woman would need a C-section?
There are several reasons. Prolonged labor, abnormal positioning, fetal distress, birth defects, or if she's already had a previous C-section and is not a great candidate to what we call VBAC or have a vaginal birth after cesarean section.
So now that we have a clearer understanding of C-sections and the risks of having a C-section and sometimes why it's necessary, what steps has Bakersfield Memorial Hospital taken to lower the number of C-section rates?
Well, we've worked really hard on that. One reason that we saw that there were higher C-section rates were inducing someone a little too early. Waiting till their cervix is more ripe is actually more beneficial and can help promote a natural birth. We also worked on not giving the wrong medications or giving the medications too quickly so that you promote more of a natural progression. Really understanding that and then also supporting labor by actively managing it, by turning the patient, supporting the patient, encouraging the patient, listening to the patient, including them in the care. We've implemented the peanut balls, which help open up the pelvis as you do different positioning, and we work with physicians. Having a physician on staff and actively managing the care together has really been beneficial. We don't have those 5 o'clock sections anymore where the doctor, it's 5 o'clock, he's ready to go. We don't do that anymore. We have physicians on call to take call for them. They don't feel rushed, and we just don't allow that. We work with them to promote better care for our patients.
So by changing when you give medication and active patient management by physically moving the patient around into different positions and by really being patient, you can promote at that point natural childbirth.
Yes, you sure can. Changing positions, helping the patient labor down, even if the head is just what we say like a little asynclitic or in an OP position, which is sunny side up, by doing certain maneuvers and certain laboring positions, you can actually help that head turn and come down a little faster.
Any final thoughts, Brenda, for someone listening about pregnancy and lowering C-section rates?
I just would say be informed. Speak to your doctor and make sure that you're relaying what you want and trust the process. But rushing and trying to, we call it TOT, tired of toting. They want to be induced. They want to deliver because they're tired. But the nurses will just really encourage them to not rush the process. It's a long process. And when it's your first baby, it's not like a TV show. It's not a half-hour thing. It is a process. But what they need to do is just work with it, stay calm, bring things that comfort you. Doulas can be very helpful, supportive family members, just to get you through it, because it can be a long process, and just don't give up.
Well, that's the perfect place to wrap this up. Brenda, this has really been informative. Thank you so much for your time.
Thank you so much.
That's Brenda McMurtry, the Director of Maternal, Child, and Women's Services at Dignity Health Memorial Hospital. And for more information, please visit dignityhealth.org/Bakersfield/maternity. That's dignityhealth.org/Bakersfield/maternity. And if you've liked what you've heard on this podcast, please share it on your social channels and be sure to check out the full podcast library for topics of interest to you. This is Hello Healthy, a Dignity Health podcast. I'm Bill Klaproth. Thanks for listening.